Let's begin at the Pumwani Maternity Hospital, where normal operations have been suspended after 41 health workers tested positive for the coronavirus. The 41 are among 450 healthcare workers who have tested positive for the virus. And as Mashirima Kapombe reports, only emergency cases will be handled at the facility for the duration of this shutdown.
A fact-finding mission at the Pumwani Maternity Hospital a day after health workers complained of neglect by the government and began a go-slow to protest the same. Tuesday afternoon, 41 health workers out of 290 who had been tested for COVID-19 turned positive. The hospital has a total staff load of 490.
Nobody has gone to hospital for care, and we are hopeful that they'll be able to pull through without developing any symptoms of COVID.
The 41 are among 450 healthcare workers who have tested positive for the virus since the first case was reported. A breakdown by the Ministry of Health shows most of them have no underlying issues.
414 don't have any underlying problem. No wonder most of them are asymptomatic and they qualify for home-based care. Only 16 had hypertension, 6 of them had asthma, 3 people reported diabetes, 5 are HIV positive, 1 had hypothyroidism, 1 with cardiomyopathy, and 4 with other cases.
Among the 41 health workers who tested positive for COVID-19 at Pumwani, 2 were medical officers, 2 clinical officers, 14 nurses, and 1 laboratory technician working in the theatre, wards, newborn unit, among other departments.
2 who are coming from the building works, 4 from CCC, 2 from CSSD, that is where we sterilize things, 1 from housekeeping, 1 from isolation, 2 from kitchen.
Pumwani is the third facility in Nairobi County under the Nairobi Metropolitan Services to be affected by the coronavirus after Kibra and Ngara health centers. Testing of staff at the facility started last Friday, while 100 were tested Tuesday.
I want to urge members of the public not to stigmatize our hospital or our health workers. There is a lot of community infection, so we cannot say our staff got the infection here or in the community where they come from.
It is now expected that contact tracing will include mothers and babies attended to by health workers who turned positive. Pumwani delivers between 50 to 120 babies normally on a daily basis, while 15 and above are delivered through cesarean section. The ministry, however, reiterating that the health workers' concerns have been addressed.
And I've been assured that we have sufficient quantities of PPEs, personal protective equipment. Further, we have agreed that beginning today, we'll have an isolation center dedicated for staff of the hospital at the School of Nursing for those who may not meet the criteria for home-based isolation.
The hundreds of women who seek services here will now have to look elsewhere as the 94-year-old hospital takes a breather. Mashirima Kapombe, Citizen TV.